to today's HealthLine webinar from the American Association of Kidney Patients, titled Delta Virus Vaccines in Kidney Patients, Ongoing Threats to Weak Immune Systems and Kidney Transplants. My name is Erin Kale, and I am AAKP's Director of Patient Insights, Data Analytics, and Advocacy. I oversee our patient research and education activities, as well as our grassroots engagement activities, including our Ambassador Initiative, which comprises highly motivated and engaged patients, caregivers, and living kidney donors around the country and the globe. AAKP's HealthLine webinars fall under our Center for Patient Research and Education. We believe patient and caregiver education is an integral part of treatment and protection of patient lives. We built the center with the latest polling and engagement technologies to ensure that kidney patients take a central role in informing the federal, academic, and private sector research shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We have a wonderful program today, and I'd like to introduce Ed Hickey, AAKP's Vice President and Chair of AAKP's Veterans Health Initiative. Ed, I turn things over to you.
Thank you very much, Erin. First, I would like to thank everyone who has shown a concern for kidney patients and the continued threat of COVID-19. As we all know, the coronavirus has been a serious threat to all Americans for the past year and a half, and it continues to severely impact those with underlying health conditions and those who are immunosuppressed, like kidney patients. I pray for everyone who is facing or who has faced the threat of this disease. Today's presentation will provide important updates on COVID-19, new variants, and information regarding the U.S. Food and Drug Administration's recent approval of a third vaccine dose for those of us who are immunocompromised. I would like to encourage everyone listening to join AAKP free of charge and become part of the largest kidney organization in America that provides a fully independent patient perspective to every elected, appointed, and career government official involved in kidney care. AAKP has worked hard over the past year publicly and via private conversations to make certain COVID-19 prevention and treatment options reflect the concerns of the kidney patient community. Over the past several weeks, we have issued patient impact statements to publicly thank FDA and the CDC for their decisions to make third dose vaccine available for compromised kidney patients and transplant recipients. We also issued a patient impact statement yesterday to thank the FDA for their formal approval of the Pfizer COVID-19 vaccine. Here are some images of those patient impact statements. As you can see, your involvement with AAKP and your views help decision makers in every sector make better decisions on issues that may very well impact your life, your health outcomes, and your economic security in the months and years ahead. Please get involved so that we can elevate your concerns and your voice. I will now ask AAKP Chair of Policy and Global Affairs, Paul Conway, to talk about our survey research on kidney patients, COVID-19, and vaccinations. Paul?
Hey, thanks a lot, Ed, and welcome to today's program. So you've heard a lot about AAKP's Center for Patient Education and Research. And what we'd like to do right now is go through a couple of different survey results from our March survey on COVID-19 and a recent survey that has not gone public yet on COVID-19 as well. And what I want to do is highlight a couple of different things here for you so you can see the influence that fellow patients and medical professionals and trusted sources have on patients' decisions on taking vaccines, and how well the transplant community has done and how important it is for us to keep doing what we're doing to stay safe. And that's, again, part of what our discussion here today is with Dr. Montgomery. Why don't we go to the first slide and take a look at a result from March. In March, we asked this important question before the vaccines were readily available. Do you plan on getting a vaccine as a kidney transplant patient? 75% said yes. At AAKP, with our education platforms, we were very focused on those who said they were unsure. We'd also like to change the minds of those who said no. As we drill down on the folks who said that they were unsure on getting the vaccine, probably the most important thing that popped out, and you can see it here, over 70%, talked about the issue of safety. And you see that picked up again in the second point there on hesitancy as well. So the question on safety then becomes, what changes somebody's mind? And the first element here, over 50% are saying more education on the risks and the benefits. They're saying that the influence of their physician or their medical team, over 50%, nearly 60%, said that that would make them feel more comfortable. And in the last one, nearly 50% said if they knew that a fellow patient had already gotten the vaccine or planned to get the vaccine. So in summary, it's education, it's expert sources, and it's the importance of knowing what another patient is doing and if they've gotten the vaccine as well. This is some of our data recently from our August field survey. And what you can see here is that the kidney transplant community has done a spectacular job over the past 6 months getting the information they need to make the right decision about safety, risk, benefit, and listening to their doctors. 92% of us have gotten our vaccines and gone through that regimen, which is spectacular. We're still working on the 8%. So what made people comfortable to get up to that number of 92%? First, they believe that the vaccine is safe and effective. Second, they believe that any potential risk benefit comes out on the side of the benefit. And that's a very overwhelming number. The role of the physician here is emphasized again at over 60%. And you have some lower numbers, which is family and that type of thing. But clearly, the most effective impacts for patients on vaccines are getting information that's sound and accurate, making certain that the risk benefit makes sense to them and is readily explained, and the role of the physician and medical expert. We asked this question to get a better idea of what patients are doing beyond vaccines to take care of themselves. And a great development here, you see the access to telemedicine issues and the utilization of telemedicine to stay safe while people are at home. You also see that people are taking the initiative, patients, to avoid going to public places and to avoid family gatherings and social events to make certain that their risk profile is reduced as much as possible. These different methods, in addition to the vaccines, are what patients are adopting on their own initiative to stay safe. So this is probably the most important one as we go on to our speaker, which is, what do you imagine the impacts and the effects of the pandemic? How is it going to end? And in this one, you'll see that overwhelmingly, patients believe that there'll always be some type of risk with COVID that's present. And that's important because what it says is there's a high sensitivity to risk. And that's something that we can work with as advocates and as an organization, because we can build our education programming on top of that with medical experts like Dr. Montgomery. So at this point, I'd like to turn things back to Aaron. And Aaron, why don't you go ahead and introduce Dr. Montgomery. I think everyone who's watching and listening to this will find that Dr. Montgomery, far more than being a medical expert, he's a patient just like us in so many ways. Thank you.
I would now like to introduce Dr. Robert Montgomery. Dr. Montgomery is the chairman and professor of surgery at the NYU Langone Health and the director of the NYU Langone Transplant Institute. He received his Doctor of Medicine with honor from the University of Rochester School of Medicine. He received his Doctor of Philosophy from Balliol College, the University of Oxford, England, in molecular immunology. Dr. Montgomery completed his general surgical training, multi-organ transplantation fellowship, and postdoctoral fellowship in human molecular genetics at Johns Hopkins. For over a decade, he served as the chief of transplant surgery and the director of the Comprehensive Transplant Center at Johns Hopkins. We appreciate Dr. Montgomery for taking the time to speak with us today. We have several questions that we would like to pose to you and our other speakers. Our first question is, thank you. Our first question is, what was your experience receiving the COVID-19 vaccination?
Yeah, so, as a frontline healthcare worker, I was probably among, the first transplant patients to receive the COVID vaccine. So just to give you a little bit of background, I'm a transplant surgeon, as mentioned, and I'm also the recipient of a heart transplant. I have a genetic disorder, and that resulted in my heart failing and having arrhythmias and many near-death experiences before I received a heart transplant in 2018. I actually received a heart transplant from a donor who was a drug overdose victim and had hepatitis C, and I was part of an early trial to receive a heart from a hepatitis C positive donor, and I was hepatitis C negative, and then I was treated for hepatitis C after the transplant, and was able to, with the new medications that are available, eradicate the virus. So I feel very fortunate to have had that opportunity to receive a gift of life and continue to be able to contribute to society as a transplant surgeon. Anyway, so as a front line healthcare worker, I was offered the vaccine, the mRNA vaccine, in December of 2020, and I had 2 doses, one in December and one in the beginning of January. And of course, we had some concerns in the transplant community that because of the immunosuppressive drugs that we all take to prevent our organs from rejecting, that it might also dampen our response to the vaccine. And so, again, as one of the first transplant recipients to receive the vaccine, I had my antibodies checked afterward, and I was part of the Hopkins trial. I think I was the first patient enrolled in that trial, where they were monitoring the response to the vaccine. And so I received the results of the antibody screen, and I wrote an email to the Dr. Segev, who was running that trial, and the title of the email was "Houston, we have a problem," because indeed I had no response, no antibody response to the first 2 doses of the Pfizer vaccine. And so, then as the data started to roll in from other transplant recipients, it became clear that this was indeed a problem that at least half, maybe a little more than half of individuals who were in the Hopkins study had no visible response to the vaccine. And the NYU Langone Hospital administrators were aware that I hadn't responded, and again, because I was a practicing transplant surgeon and seeing a lot of patients who were infected or potentially infected, they offered me a 3rd dose of the vaccine, and the vaccine that they had at that time was the J&J. And so I did receive an additional dose, and that was in February of this year. And when we rechecked my antibodies, I had a very vigorous response to that 3rd dose. So now, as time went on, it became clear that this was a story that, was playing out with most transplant patients. And so we publicized, this information. You may have seen some articles in the press that included the Hopkins study, and also interviewed me about, my experience. And so, full circle, now we have, as a transplant community, an opportunity to receive a third dose. Not quite the way I did it, because it was kind of uninformed at the time, but the CDC and the FDA is offering the opportunity to receive a third dose of the mRNA vaccine that you had originally received for the first 2 doses. And unfortunately, they don't have a clear picture yet about the J&J vaccine, and have not made a recommendation for the patients who received J&J as their primary vaccine.
Thank you, Dr. Montgomery. We have a couple of questions for you. We have somebody that reached out to us. They are a post-transplant recipient of 49 years, which is amazing. They developed antibodies 1 month after their second Pfizer vaccine. However, at the 3-month mark, their antibody count dropped by a half. Can you tell us if there's any benchmark of how many antibodies you need to be protected from COVID, and if the third dose will be recommended for all transplant patients?
Yeah, so that's a great question, and unfortunately, there's still a lot we don't know about this story. It's being written as we speak, and one of the things that's a bit unclear is, what is the antibody level that is protective, that is sufficient in order to prevent infection. And now with the Delta variant, we know that even non-immunosuppressed patients can become reinfected who are fully vaccinated. And so, as Delta becomes the dominant, or has become the dominant variant, the question is also, what level of antibody will protect you from severe disease, which is kind of, I think, the more pertinent question now. And again, we don't have clear data, although there are some benchmarks that have been informative. And so really, I think at the end of the day, because of that lack of clarity, the CDC has not recommended that you have your antibodies checked prior to receiving the third dose of the vaccine. So they are recommending that all solid organ transplant patients receive a third dose. But again, if your first dose was not one of the mRNA vaccine, in other words, if it was a J&J vaccine, there's not a clear recommendation at this point for what should happen in that particular case. I'm told that that information will be coming out in the near future, but right now the recommendation is that those who received either the Pfizer or Moderna mRNA vaccines who have a transplant, so all patients who've had a kidney transplant would be included, should receive a third dose of their primary vaccine. So if your primary vaccine was Pfizer, a third dose of Pfizer. If it was Moderna, a third dose of Moderna. And you should do that without having your antibody levels checked before receiving the third dose. And the third dose should be given no less time than a month after the second dose. So you should, if you've just received the second dose within the past month, you should wait. And then I think it's going to be up to the physicians who are caring for the patient as to whether or not they check an antibody dose after the third dose, or an antibody level rather after the third dose. Now, the phenomenon that the viewer described is a kind of a separate issue from what we're talking about. So the question was about the antibody waning or falling off. So one of the things that the CDC, made really clear is that the third dose should not be referred to as a booster dose, because a booster dose is usually given when someone does have a good response to a vaccine, but that level of antibody starts to decrease over time. And then they would receive a booster to bring the level back up to where they had been. In the case of immunosuppressed patients, what we're seeing is at least half of them don't respond to the vaccine at all. So the third dose, from the research that's out there, it suggests that a third dose will very significantly increase the likelihood of a primary response. So in the case of the person who asked this question, it sounds like they had a primary response that was pretty good, but then the antibody level dropped over time. And so slightly different question, but this would be a situation where, we would normally give what we call a booster to boost that level back up. And so, again, one of the things we don't have a full picture on in the immunosuppressed patients is how, if they did have a primary response, how sustained that primary response to the vaccine is. We're just learning that now, but it looks like for this particular patient who's asking the question that they had a good primary response, but then it dropped, below a level that whoever interpreted it thought was protective. Does that answer the question, Aaron?
I think it does. Thank you. So it's there's still a lot of questions out there, but it sounds like this third dose will ultimately help build those antibodies.
Yeah, and the majority of the patients who didn't have a response to the first two doses, the research has shown that a third dose is likely to give them a response, but it's not 100%, I'm afraid.
Right. Thank you. We have a question from someone who is asking if they had an earlier variant of COVID and they received 2 shots, does that make it 3 doses? Do they need to get the third dose? So I think there's a little confusion around, if you've had COVID, does that mean you don't need the third dose? If you could address some thoughts on that.
Yeah, so we know quite a bit about the question you asked for patients who are not immunocompromised. So if you're not immunocompromised, if you haven't had a transplant, and you had COVID, an earlier variant of COVID, maybe the original that was part of the early pandemic a year and a half ago, we know that offers some protection when you've had COVID, but that it is possible to get reinfected. And certainly with Delta, you can get reinfected if you previously had COVID. Again, for the non-immunocompromised, we know that if you had COVID and then you got the mRNA vaccine, you got a really good response that seemed to be sustained after the vaccine. The best, of all the combinations that you can think of having the vaccine and receiving the vaccine and having COVID. I think the jury's kind of out as far as the immunocompromised patients. There's just not enough that have had COVID and then received the vaccine to really know the answer to that question. But there's no distinction in the CDC guidelines that would suggest that someone who had COVID then received Pfizer or Moderna vaccine, 2 doses, shouldn't follow the guidelines of all the immunocompromised patients who are getting a 3rd dose. So just to be clear, if you did have COVID and you were vaccinated with Pfizer and Moderna, the recommendation is to get a 3rd dose.
Thank you for that information. Another question that we have received from patients is if everybody in the household has received a 3rd dose of the vaccine, is that safer, or is it okay if only the transplant recipient receives a 3rd dose and not the rest of the household?
Right. So the concept here is that there's some protection that is offered by having the individuals who you're most closely co-localized with to be fully vaccinated. And the assumption there is that they're not immunocompromised. And so for the immunocompromised patient, there is this safety layer, this sort of buffer by having your family members vaccinated. And even, your coworkers, if you work in an area where you're close together with other individuals. And so the idea of the 3rd dose really is just for the immunocompromised patient who might not have had a primary antibody response to the 2 doses of the vaccine. Now, as you all have heard, there is a recommendation that after September 20th, I think it is, that the general public, so the non-immunocompromised population, will be offered a booster dose. So again, the idea is to try to, if you weren't immunocompromised, there's a greater than 95% or 96% chance that you will have had an excellent initial response to the vaccine, but that could have waned over time because some people now are 9 months after the vaccine, and so they're being offered a booster dose to try to bring their antibody levels up again. So I think the recommendation right now, as I would interpret it, is the immunocompromised patient, the transplant patient, should receive a 3rd dose immediately. And then once the booster doses are available to the general public, then their family members should receive a booster dose in order to offer that extra line of protection.
Thank you. Do you recommend that transplant patients who do get a 3rd dose, that they still wear a mask and practice social distancing and whatnot, around family and friends?
Yeah, that's a great question, Erin. So, the idea here is that, the 3rd dose is being given without the recommendation of checking antibody. And so, we're not going to know for sure whether there was a initial response to the vaccine. And I think in many cases, people aren't going to, automatically get their antibodies checked after the 3rd dose. So while we know that that third dose offers, additional protection to many of the immunocompromised patients, the recommendation is still going to be to continue to do social distancing, and wearing a mask, because again, without that definitive information about the antibody level, and also without really knowing what level of antibody is truly protective, and with the Delta variant, where even if you have a protective level of antibody, you could still become infected. It's just too risky in the current, environment, where Delta is so prevalent, to take any chances that you wouldn't have taken a year and a half ago when this started. So, again, we know the vaccine very significantly reduces the severity of COVID and can prevent severe disease and death. And we know that transplant patients, at least initially, during the surge here in New York, had a very high mortality rate, up to 25%, when they were symptomatic from COVID in the hospital. So 3 doses of the vaccine will offer the vast majority of patients a level of protection that should prevent severe disease and death. And that's really what you're going for. That's what you're trying to achieve currently, particularly with Delta. But the best thing is to never get it. And we are seeing, some of the symptoms, the so-called long COVID symptoms that last for a long time in patients who were minimally symptomatic. And so, again, the best thing is to avoid infection and avoid the risk. And the vaccine should just be seen as something that, increases your level of safety, but shouldn't be relied upon completely.
Thank you. Very important words. And one final question for you. What would you say to someone who is hesitant to receive the vaccine, even that first dose? And you might want to answer this in 2 parts. One as a transplant recipient yourself, and then another as a transplant surgeon and healthcare provider.
Yeah, I mean, I certainly understand that this is, a new frontier, and this is a novel virus, and some of the mechanisms, that of the vaccines that we're using are relatively new, and people do have concerns, that about the safety and longer term effects. Some people just really are opposed to vaccines in general. What I can say as someone who was in New York during the surge, between March and April of 2020, is that we lost over 300 transplant patients in New York, and that this is a very, very serious disease that is the most horrific infection that I've seen, and it's particularly bad in transplant patients. Again, I'm a living example of a transplant patient who was among the first to be vaccinated. And I really, even though we didn't know at the time how safe this vaccine was going to be for transplant patients, I couldn't imagine anything worse than what I had seen in terms of transplant patients who got COVID. And so I had no hesitancy myself to get the vaccine before anyone else had gotten it. And And I still, now we have a lot of data. A lot of transplant patients have received the vaccine. And one thing I can say is it appears to be very safe. It's not as effective as we had hoped, but it's safe. And so I would just encourage, unless you are, are okay with, spending years in isolation, that you should get the vaccine. It truly is the right decision to make.
Thank you so much, Dr. Montgomery. I know your time is limited now, so I wanted to see if Paul or Ed have any final questions for you, and then I'll just close things out.
No, I actually don't. I think on behalf of AAKP, Doctor, thank you so very much for your time. Your story is moving, and your empathy for fellow human beings is distinct. And thank you for trying out the dosing first before we had access to it. And everything about you, you're in the business of saving life, and thank you so very much.
Well, thank you. Thanks very much for this opportunity to, to speak to patients, my fellow patients. And I just wish everyone, the good health and longevity.
Thank you so much, Dr. Montgomery. We appreciate you sharing information about the COVID-19 vaccine, the recommendation for the third dose for immunocompromised individuals, including solid organ transplant recipients, and of course, your personal experience as a heart transplant recipient. Thank you so much. We hope you are safe and continue to be well. Thank you. If you are not already a member of AAKP, we encourage you to join us. We offer free membership to patients and family members, as well as living kidney donors. To make certain you receive notices to participate in our surveys and receive future statements, please include your email address when joining AAKP online at www.aakp.org/join, and you can also follow us on social media. For copies of the patient impact statements AAKP produced related to the recent FDA and CDC vaccine decisions, please visit our website at www.aakp.org. AAKP is dedicated to helping patients understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and caregivers. We also offer numerous kidney-friendly recipes with details on the nutritional content and which stage of kidney disease these recipes are good for. By visiting our website and clicking on the AAKP store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download. You can also order materials by phone. AAKP's events in 2021 will once again be held virtually with no registration fees. We invite you to join us at our 46th National Patient Meeting, taking place virtually September 24th through 25th, with no registration fee. We also encourage you to visit our YouTube channel to watch presentations from our past events. I'd like to highlight our coronavirus resource page for additional patient resources on COVID-19, including previous webinars AAKP has hosted with our strategic partners like the Centers for Disease Control and Prevention. You can access this page by this link or from our www.aakp.org homepage and clicking on the red coronavirus information button. We'd again like to thank Dr. Robert Montgomery for sharing information about the COVID-19 vaccine, the third dose recommendation for immunocompromised individuals, including solid organ transplant recipients, and his personal experience as a heart transplant recipient. We hope you will continue to be informed and stay safe.